Good evening, everybody, and welcome to our CNS prone lateral webinar. We have a great faculty lineup here, Dr. Shiraz Qureshi and Dr. Juan Uribe, really experts in this field and experts in lateral surgery and minimally invasive surgery. I'm going to go ahead and get started with our first talk. We're going to have two talks, and then afterwards we will have a question and answer and discussion section.
So what's the case for doing Transpsoas surgery prone? Well, I think the biggest case is that it avoids time to reposition, and the initial positioning is extremely straightforward and something that we as spine surgeons are very comfortable with. In the prone position, because we allow for extension at the hip joints and allow for increased lordosis, the femoral nerve moves posteriorly. We can see, though, once the screws are placed, the lateral interbodies are placed, the patient is ready to have rods inserted, and this could be a significant time saver in terms of a patient having a good outcome here. I'll stop here and pass the talk on to Juan, but of course we'll hang around to answer any questions. Thank you again so much for having me.
There is very little, as you see here, between the prone, you see the location of the psoas with relation to the vertebrae on the prone with the hip extended compared to supine is almost the same, which is a great news because it means that the MRI that you have preoperative on your patient is going to be very close of the images that you're going to have when you put your patient in prone position. Again, so there is some unique features of the prone lateral approach, and you have to take this one with you home because these are the two big differences and principles on prone lateral surgery. One is, don't forget, gravity is king. So everything you put, as Shiraz mentioned, likes to move anterior. And from here, I'm going to show you two cases. One of the cases is perform 100% of the fluoroscopy. The other one is assisted with navigation. So you see here, I'm wandering on the anterior part of the muscle until I find a good entry point without compromising. This is something that I cannot see it on 2D x-rays, you know? So this actual view, the three-dimensional view of the spine is a huge value specifically in prone lateral.
I'd like to thank all the viewers for participating in this webinar. I'd like to thank the Congress of Neurological Surgeons. And with that, we will conclude this webinar. Good night, everybody.